October 29th through November 4th is National Obesity Care Week, and here to tell us more about what we need to do to avoid obesity is Dr. Jaime Ponce from CHI Memorial. Did I get that out correctly?
Yes.
Stop just for a second. I want to make sure I had the correct
you.
pronunciation. So great to have you. This is your first time on Let's Chat. So thank you. Such an important topic. Let's start out, though, by just letting our viewers know a little bit about your practice that you have there with CHI Memorial.
Correct. So I'm a bariatric surgeon. What it means is I do weight loss surgery, but we also do a lot of weight loss treatment. So CHI Memorial has a practice that is called metabolic and bariatric care. So what we do is to take care of patients that are suffering from obesity and help them either with diet plans, therapies, medications, and even surgery for those that have more severe obesity.
Right, but that's what I love, you know, just learning about this and about what you do, because especially with the importance of the next week coming up, with it being the Obesity Care Awareness Week. I love the fact that you really are about educating your patients first, and that's kind of where it starts. You actually guide them through a process and kind of let them know what their options are.
I think this is the goal. So next week is going to be the National Obesity Care Week, and what it's going to do is create awareness about the problem of obesity. Many people probably don't know, but the latest statistics from the CDC states that 39% of the population in the United States are suffering from obesity.
Right. Wow.
And it's not only obesity, it's the consequences of having obesity. You know, the healthcare problems, type 2 diabetes, high blood pressure, sleep apnea. And then when you look at quality of life, disability, all those problems are increasing with obesity.
Right, but when we do talk about obesity, I think it is important to, you know, acknowledge the fact that it is a disease. There can be so many different factors that can lead to this, correct?
Yeah, so the American Medical Association has designated obesity as a disease. There are many components that contribute to these. There are genetic components, metabolic components, as well as our environment. And so if you put all that together,
hormonal, I guess, and women's
hormonal,
especially,
yes.
that can also be a factor.
So there's different treatment modalities, and it all depends on how bad the obesity is. You know, the people that have lesser degree of obesity, you know, they can be approached with diet, exercise, lifestyle modification. Then we can add some medications. The FDA has approved 4 medications that suppress the appetite and allows them for a diet to work much better. And then for those patients that have more than 100 pounds above their ideal weight, surgery becomes the most effective therapy.
Right.
Now, surgery is always a big word. You know, people are scared, you know, it's fear. But bariatric surgery actually has become much safer than many other surgeries. You probably have heard about laparoscopic gallbladder surgery or laparoscopic hysterectomy. Well, bariatric surgery is as safe or safer than those surgeries, especially if it's done in an accredited center, what is called Center of Excellence. So CHI Memorial is an accredited center, has everything in place, and is recognized by all the payers as a center of excellence.
Right. And patients do not necessarily have to have a referral. They can just come and see you, and again, you can from there discuss their options, because a lot of them have tried many things, and you get frustrated, and you think, is surgery, am I even a candidate for that? But I guess coming in and making that consultation with you is the best place to start.
Best place to start is just, they can log into the website or call. We usually direct them to a free seminar. They don't even have to pay anything. Free seminars, we have 4 a month. And what it does is just give them an options, you know, inform them about the options, and then from there they can set up a consultation, and we can go from there.
All right, holidays right around the corner. Got to ask you while we have you here. Any tips for not overeating over the holidays? We have just a couple of seconds. What tips can you give us?
You always need to limit your portions. You know, you always put on your plate and limit your portions. Second one, don't stop doing some activity. So limit your portions and move.
Eat but move, right? All right,
Correct.
Some great tips. Thank you so much, Doctor, for being
you.
here. And for more information, you can find his contact right there on your screen. There's the number as well as the website. Thank you again so much for being here. And stay with us. We'll be right back to wrap up Let's Chat in just a moment.